Kind of a rowdy crowd tonight. I guess that's good. Well, thank you, Mamie and Amy. And to all of you, let me just say that I'm continually humbled by the generosity of this community and its willingness to support this organization. Our mission is really important, but we sometimes have a hard time of helping people understand what it really is all about. In many instances, we're kind of one of those just-in-time organizations that you're grateful you know about in a time of need, but then when the need passes, we kind of just escape out of sight, out of mind. But what we're hoping for tonight is that this event and the stories and the lives that you'll be touched by will help you appreciate how important shared goals can be in helping families face life's most difficult challenges. Our work seems to have taken on new significance just in the last few years. The few of us who've been at this work for more than 3 decades now think it's about time that we hit pay dirt. I'm not quite sure if that's due to the fact that the American public is finally waking up to the fact that we're an aging society and death is not one of those things that we can opt out on. But as medical knowledge advances and technology continues to grow, the question we continually have to grapple with is not what we can do, but what ought we to do? What is better and what is worse? What is helpful and what is harmful? That's where the center and its patient-centered focus is critical. Throughout its history, the center has taken on difficult and often controversial issues to make a difference in the lives of patients and the people who love and care for them. In other words, really all of us at some point in our lives. Many of you may remember about a decade ago when Missouri was in the throes of the controversy over stem cell research. The center took on the task of engaging the public and policymakers in what we hoped would be a civil discourse about this hot-button issue, in bringing together the basics of science from some of the best and brightest, like Bill Neves, and also those with divergent political perspectives. I think we managed at the time to make everyone a little more uncomfortable with their implicit biases, and hopefully also a little more tolerant and appreciative of the opponent's perspectives. I know from our perspective, we pretty much had to judge our success on how upset everybody was with us for not taking sides. That no one was entirely satisfied despite all the human and financial capital that we invested in that project. It was affirming and in a way confirmed the work that we were doing was the right thing. Certainly at the center of that debate a decade ago was our own Stowers Institute, which, as we all know, not only survived, but has thrived. Its continued work in the area of seeking cures through biomedical research has gained international recognition and has helped establish this region as one of the premier life sciences regions in the country. It's an honor and a pleasure tonight to be honoring Virginia Stowers, one of the founding visionaries for that work. A tenacious and humble leader who believed in Kansas City's commitment and its ability to lead on the scientific front. It's more likely that the vast majority of this audience is familiar with the center's work on end of life. We've been at it for more than 30 years. More recently, we've also led local, regional, and national efforts to change the way that chronic pain is perceived, judged, and treated, as well as to explore better ways to meet the ethics protection that patients need in clinical research. We welcome the changes that are coming about in research, improving clinical practice by comparing what works and doesn't work. And here's a novel idea, even involving patients in deciding what research should be conducted and how important it is for them. We're finally getting at what really matters in health outcomes. As you all know, the ultimate outcome, however, is how we die, and that is very close to the center's core. So this is a welcomed and long-awaited refocus in the American clinical practice. We hope to explore that even more deeply tomorrow at the Joanne Berkeley Symposium as we delve into the meaning of what it means for clinicians and families to reclaim death as a human experience. We'd like to get a jump on that this evening, and we hope that by the end of tonight's program, you'll have a deeper understanding of the importance of the most notable and long-lasting work of the Center, helping families deal with life's biggest and often most confounding decisions in the face of life-limiting illness. Our work in this area is devoted particularly to person rather than policy. While we've navigated the public policy arenas to advance our cause, our real life, real issues, and real-time commitment is to conversations. Conversations about values and wishes and convictions, honoring preferences and being clear about the goals and hopes and expectations that we have in our final chapters.